Hey everyone, this is Chris Murphy, United States Senator from Connecticut. Thank you to Northwell Health for making this commitment to investigating the causes of gun violence in America and investing in a broad-based conversation to make sure that we are all swimming in the same direction with respect to the solutions. This is a uniquely American problem. Nowhere else in the world do citizens have to endure this level of carnage. America has 20 times the rate of gun homicides that other high-income nations do. And it is hard to explain the scope of the damage that is done to this nation. We tend to talk about it in terms of deaths. And those numbers are stunning. 100 people every single day are dying from a gunshot wound. Most of those are suicides, but many are homicides and accidental shootings. But of course, those are just the deaths. There are the injuries, the people who are struck by bullets and their lives are never the same, even if they survive. Then there are the family members and the friends who experience trauma after the death of a loved one. Research shows that when one individual dies unexpectedly from a gunshot wound, there are 20 other people who are subject to some kind of diagnosable trauma. And then there are the unseen wounds that accrue to people that actually never actually get shot or may not have a close family member who are shot. These are the kids who go to school and live in violent neighborhoods. These are children whose brains are literally fried by the constant injections of cortisol, the fight or flight hormone that occurs because they fear for their life legitimately every single day. Research tells us that these children have levels of PTSD that are just as high as returning soldiers from Iraq or Afghanistan. These children can't learn, they can't cope, they lack resiliency skills because the circuitry of their brains have been changed by their constant exposure to the fear of gun violence. I talk to these kids all the time. As healthcare providers in our cities, no doubt you speak to them as well. And so you know how they feel. But you also know how they feel left behind. They know that their plight is being ignored by Washington, by state legislators, by policy leaders. They know that there are kids who go to school just miles away in the suburbs outside of New York City or Albany or New Haven or Bridgeport, who don't have to think 1 minute about whether or not they are going to be killed when they're walking to the local bodega to pick up food for their family. And that inferiority complex, it isn't as damaging as the trauma itself, but there's damage done that way as well. And so it's no coincidence that the low-performing schools are all in the violent neighborhoods. If you fix the epidemic of gun violence in this country, you certainly save a whole bunch of lives, but you also save a whole bunch of children's futures that right now are being compromised, stolen from them because of this epidemic of gun violence. That's how big this problem is in America. And so the question is, what do we do about it? And what is the responsibility of healthcare providers to lead here? Well, I recently wrote a book on the epidemic of gun violence in America. It's called The Violence Inside Us. And while I'm probably best known in the Senate for my work on changing America's gun laws, I make the case in this book that even if you were to change all of America's gun laws, if you were to perfect America's gun laws to make sure that no criminals have access to weapons, that all the really dangerous semi-automatic weapons are off the streets, you still wouldn't get our gun violence rates down to the levels we see in places like Europe. Why? Well, because America's story of violence is much more than just a story about guns. It is a story about racism, and it is a story about poverty. America is a country that is founded on violence. First, violence against Native Americans, but very quickly thereafter, violence against African Americans. And to this very day, our society is ordered around the perpetuation of violence against populations like Black Americans, like Hispanic Americans, that white majorities want to keep oppressed and subjugated. Now, it may not be as overt as it was in the middle 1800s, but if we don't understand the ways in which we have simply changed the method of violence from slavery to extrajudicial lynchings to incarceration, then we aren't understanding the scope of this problem. And so if you want to do something about violence in this country, then you have to be present for the conversation about racial justice. You have to be invested in the conversation about changing these systems of systemic and systematic oppression in America. Second, the one true correlation, the closest correlation to exposure to violence in this country is actually not access to weapons nor race, it's income. The story of American suicide is a really different story than the story of American homicide. If you're Black in America, you're twice as likely to be the victim of a homicide. If you're white in America, you're much more likely to be the victim of a suicide. But what tracks suicides and homicides and accidental shootings and domestic violence crimes the closest is income. If you're poor, you are just much more likely to be the victim of a homicide or a suicide. I remember talking to a young kid in Baltimore during a visit there in research for my book, and he said to me, I've been looking for a job for months. I've been filling out applications every day, nothing. And so at some point, I'm left with no options. If I can't get a job, then I gotta rob, I gotta deal, or I gotta steal. Another older man in that same neighborhood said to me, listen, hunger, it hardens your heart, he said. When you wake up hungry every day, you do things that you wouldn't otherwise do. It was his way of explaining the epidemic of violence in his neighborhood in Baltimore. And so if you're not serious as a healthcare system about being invested in the conversation about racial justice, if you're not serious about changing the economic balance in this country and putting money in the pockets of people who have very little, then we can pass universal background checks, but it won't get the job done. And so my challenge to healthcare providers in particular is to take chances and be present in these conversations. I know that there's this sort of feeling that when you come to Washington and advocate, you should talk about healthcare regulations and malpractice laws and reimbursement rates because that's in your lane. All this is in your lane. If you care about stopping the flow of victims of gun violence into emergency rooms in this country, then you have to be advocating for universal background checks, but you also have to be invested in these other conversations as well. So that's a lot, but as I've spent the last decade of my life learning about the epidemic of gun violence, that's what I've learned. That this is a very big conversation that America has to have. We have to have a reckoning with our history, and we have to have a reckoning with the ways in which our economic order and our system of racial oppression feeds this river of gun violence that is wider and deeper in America than it is anywhere else. The final thing I want to say to you all today is to just be careful about the traps that we can all fall into when we talk about the causes of gun violence in this country. You are healthcare providers, many of you. Many of you spend a lot of time in the mental health space. You all know that our mental health system is broken, period, stop. And we should fix it. But we also shouldn't expect that by fixing our mental health system, we will automatically fix our problem with gun violence in this country, because there is no evidence that America has more mental illness than all those countries that have gun violence rates that are 20 times lower than the United States. There's no evidence that we spend less money on mental health care in the United States than these other nations have. It is just that in America, our economic order, our history of racial violence, and our easy access to weapons means that individuals who may be mentally ill often then get on a pathway to violence. Yes, people that are mentally ill are much more likely to be the victims of violence than they ever are to be the perpetrators of violence. But in this country, there is something other than mental illness that is driving violence. The data tells us that irrefutably. So let's focus on fixing our mental health system, but let's not oversell the results that it will get us on rates of violence in this country without attacking these other primary drivers of shootings and homicides and suicides in America. Thank you for bringing together this conversation. Thank you for inviting me to deliver what may be some hard truths about the scope of the work that we have ahead of us going forward. I really look forward to partnering with Northwell, with all of your partners on this incredibly important work that we have ahead of us this year and in years to come. Thanks for having me.